we're recording now.
Okay, great, thank you, and apologies. Hello everyone, sorry for the delay. I'm Sara Stefanini. I work with the air pollution campaign Every Breath Matters. We have organized this press conference with the University of Chicago's Energy Policy Institute to talk about how air pollution in South Asia affects life expectancy. This is part of the global report that is coming out right this minute. The embargo has just lifted by the University of Chicago's Energy Policy Institute, and it's called the Air Quality Life Index, which includes new data on up to 2018. And the findings in the report add substance to an open letter that more than 40 million health professionals signed in May, calling on G20 leaders to put public health at the center of their recovery packages from COVID-19. So we will now go to Anant Sudarshan, who is the Energy Policy Institute's Executive Director for South Asia, and will present the findings. Just so you know, for housekeeping, all the participants are muted to avoid any background noise. We're taking questions over the chat, and you can start sending them in as soon as you'd like. And the call is being recorded and will be available afterwards, so you can email any of us for that if you don't receive it. That's all now. Over to you, Anant. Sorry, Anant, you're muted.
Oh, thank you, Sarah. I'm just going to share my screen. Let me know if that works okay. Can you see the presentation?
Yeah.
Yeah, okay. So I won't take too long, but I just wanted to go through some interesting findings that we have from a large data update that we've been working on at the Energy Policy Institute. Some of you already know what the Air Quality Life Index is, but I'll spend about a minute summarizing what it's all about and then come to some of the more recent findings. So, you know, there are today about 6 billion people almost who live in parts of the world where they breathe air that exceeds the WHO guidelines for small particulate pollution, and most of these people are in South Asia and in China. And as many of you on the call know, the source of this particulate pollution is largely burning fuels, but by that very nature, it's also then distributed across a range of human activities and a number of sectors, which has made it traditionally even more challenging to solve, especially in South Asia, where there's a lot of household wood combustion, there's waste combustion, so there's a whole set of sources that make tackling the problem challenging. The Air Quality Life Index is both a measure, an index, and a platform. It's a platform that attempts to connect people all over the world with this data on particulate air pollution in a way that makes it intelligible. So it is based on research that links changes in life expectancy to changes in air quality. And the idea being, we don't necessarily understand what it means for air pollution to rise by, 10 micrograms per meter cube, to pick a science term, or to go from a yellow day to a red day. But I think all of us can understand what it means in terms of how it affects our life. So the AQLI website, which the link is in the material that I think Sarah has sent around with this call, is also a great source of data. So it provides high resolution satellite derived PM data for 20 years from now a recent paper that came out this year. So the most up-to-date source of this data that exists on the planet, and you can download that data freely. And what it shows is the picture that I talked about, the distribution of air pollution across the world, all centered around South Asia and China in particular. Now, it's an index that links air pollution to changes in life expectancy. You can view pollution data at the national level. You can view it down to the district level in many cases. So this is a map of Uttar Pradesh. You can see different air pollution levels in each district. In the case of Uttar Pradesh, they are all very high. So it all looks dark. You can also see trends over time now that there's 20 years of data, and I'll get to those trends in a little bit. But one of the worrying factors that we see is a continuous increase over this time. So we have certainly been talking about particulate air pollution for now more than a decade, but the direction of movement has been up, at least in India. Um, the life index converts air pollution, and this is a map of changes in life expectancy across the world. It parallels the change in the particulate matter pollution across the world that I showed you earlier. And this, I think, is key to the AQLI, that you can now look at this environmental hazard in terms that I think all of us can understand. So let me now get to some of the new findings that there are in the report. So with the expansion and updation of the data set, one of the striking facts that emerges from that is that, if you look at the last 2 decades, this is a time series from 1998 to 2018, you'll see that the years of gain in life expectancy from lowering it pollution to the WHO standards, equivalently, the loss in life expectancy from existing air pollution has remained around 2 years over that entire 2 decade period, if anything, rising very slightly. This is, this is a problem. Air pollution now is, and this is data from the global burden of disease, all the numbers on the right of the dark bar, which is the first, are a comparison of air pollution to a whole range of other public health hazards and other sources of death. And you'll see that, if you look at life expectancy loss as the metric, it's as serious or more serious than all of these on the right, on which we spend a lot of time and money and effort thinking about how we solve those problems. One of the key things that we see in that 2 decades of data is that although on average or on the planet, the loss in life expectancy has remained around 2 years, it's not been because air pollution has remained static across the world. There are parts of the world where it's dropped significantly, and China is one of those. But it's risen in South Asia, and that's that's a large part of why I think these results are worrying, at least to me. Bangladesh, Nepal, India, Pakistan, all of these countries have seen increases in air pollution over the last 2 decades. Bangladesh, from the recent data, is now the world's most polluted country. If you look at the average air pollution across the country, on an average, the entire population lives in areas that exceed the WHO guidelines. And the data suggests that this costs about 3.5 years of life expectancy in the country, which is very significant. Bangladesh, of course, has made huge strides in the public health sphere, and so this is one of those areas where we'd expect this to be a significant concern going forward. Dhaka and Khulna are the two most polluted areas in the state, in the country as a whole. Now, we also see that although Bangladesh has the highest average levels of air pollution, if you ask the question, where in the world is air pollution worse? The answer to that is India, in particular, North and Northwest India. Right, so the levels of air pollution we see there from the new satellite data are unprecedented across the planet, right? And even worse in some ways, particulate air pollution has risen in India by over 40% in the last 20 years. And when you're starting from a base like India is, that should be extremely worrying to us. The increase in pollution alone has cut almost 2 years of life expectancy of the average life expectancy in the country. So it's gone from about 3.4 years life loss in 98 to 5.2 today. Pakistan is, now the fifth most polluted country in the world. So this is just getting to what I was saying about South Asia really being the epicenter of air pollution at this point. 22% increase in air pollution in Pakistan and around 3 years lower life expectancy as a result of this air pollution. It's Punjab and Sindh, again in that northwest region, are where PM levels are the highest. Karachi and Lahore, both polluted cities. They're not as bad as New Delhi, for example, or Dhaka, but 3 years of life expectancy loss in Lahore is large. Nepal, we speak a lot about India and Bangladesh and Pakistan, in research papers and in these conferences. Air pollution levels in Nepal have risen steadily for several reasons, including the use of diesel to produce electricity. And the loss in life expectancy is now 5 years from not meeting WHO guidelines. Okay? We see the same thing in Indonesia. Again, Jakarta has about a 5-year loss in life expectancy. And Indonesia is now the 9th most polluted country in the world. So that's the sort of bad news relevant to South Asia. I just want to close with a minute on the good news from a more global point of view. For the same stark increase that we've seen in South Asia is mirrored by a decrease in China. And in some ways, this should make us optimistic. China declared a war on pollution in 2013. Pollution has gone down in China. Now, the policies that different countries use will differ, but it shows it can be done. And so, pollution in China has dropped by 40% in 5 years. Now, this no longer relies on monitor reported data from any country. This is unambiguously from satellite data. And not only has pollution dropped by 40%, but the GDP has grown by 36% in that period, right? So it's a win-win on the economic environment front. And the result of that is a 2-year increase in life expectancy on average across China. So that's all I wanted to quickly cover in the PPT. Of course, if there are any questions, we can take them. But let me introduce, we have two distinguished panelists who have know a great deal about this topic more than me, and I've worked for a long period of time. And I thought we could hear from them next. So I'll start by calling on Dr. Purnima Prabhakaran, who is the head of the Environmental Health and Deputy Director of the Center for Environmental Health. She has trained as an epidemiologist and worked for over 20 years now on environmental health, especially on children's health, if I'm right, in India. And I'd like her to talk a little bit about the problem of air pollution and, if possible, how it intersects with children's.
Yeah. Thank you. Good evening, everybody. Thank you, Anant. And let me start by saying congratulations to EPIC and UChicago for this very neat piece of work and the report. The report is really very impressive. I had a lovely read earlier today, looking at all the details within the different pieces that you've drawn together there. Just to correct at the outset, I haven't worked in environmental health for 20 years. I've been working as a public health, I'm a physician turned public health specialist. So environmental health is just in the last 5 years. And believe me, a lot of that work now has to happen around air pollution, given where we are sitting, the most polluted country in the world. So just some initial thoughts on the report. And from the health perspective as well. So no doubt, I mean, this is worrying. I mean, it's 20 years of data that you're showing us. and the trends both at global and as well as regional levels, and relating it to life expectancy. I mean, there cannot be a more compelling argument to put forth, how air pollution, every breath that we are taking is impacting our life expectancy, and how it's at different levels in different parts of the world. I think it relates back to what the situation can be, the scenarios can be if we achieve the WHO guidelines. And for me, I think sitting in India, where we know what the scenario is, I mean, achieving the WHO guidelines is a distant dream. Forget the WHO guidelines, but even achieving our national ambient air quality standards, it's a utopian dream. I think for all of us now to even think about getting there, it's become a battle. And I think we have to start thinking quite quickly about the success stories that we have seen, for example, from China. There is the success story, the war against pollution, and how they made things turn around within 5 years, as compared to even US and Europe, who took 20 years to do what they did in terms of the Clean Air Act and what it achieved. So I think there's some really important lessons to learn there for India. And we can't sit pretty any longer just because I'm thinking about the health perspectives. There's huge outcry from every corner of the world in terms of the health impacts of air pollution, and we cannot wait just to build that evidence base for India. It's already there. It might not be contextualized to our Indian situation, but there is enough evidence to show that deteriorating air quality has impacts, really worrying impacts on health. Intuitively, people tend to think it is impacts on respiratory health. It is true, there's lots of impacts on our respiratory health, but there is increasing evidence that now air pollution is really the new tobacco. We saw it's really close to tobacco in terms of the life expectancy. And we were all, as medical professionals, learned about the impacts that tobacco consumption can have, not just on respiratory health, but also cardiovascular health and a whole host of other conditions, lung cancer. And air pollution is pretty close, if not more, in terms of its health impacts. So not just respiratory health, but also top of the table risk factor now for cardiovascular health. Heart disease, ischemic heart disease, stroke, lung cancers, and worryingly so also it can have intergenerational impacts, given it has impacts on reproductive health. Pregnant moms breathing poor quality air, it can have impacts on birth outcomes, both in terms of birth weight, the gestation period, but also going forwards, there's evidence now to show impacts on cognitive development. And that's cutting right through a next generation. Our demographic dividend. If we are having children breathing poor air, it has very somber consequences for generations ahead. And I think that's why we need to sit up and take notice. And these sobering statistics in terms of reduced life expectancy are just one facet of it. But we have to take our agenda forward in a big way as air pollution and health advocates across regions, and definitely so for South Asia. So I'll stop there and maybe take questions later. This is just my initial thoughts when I read the report and the way we are sitting on the ticking bomb of poor air quality.
Thank you, Dr. Prabhakaran. I think I'll go to our second panelist then, and I think then we can collect all the questions that have come together. So our second panelist is Dr. Saida Hassan, who is an extraordinarily distinguished environmentalist and environmental lawyer. She was from Bangladesh. She was awarded the Goldman Prize in 2009, the Magsaysay Award in 2012, for a history of environmental and judicial activism in Bangladesh, in early work in the shipbreaking industry, but then working on a host of different sectors, in particular looking at environmental clearances, I believe, which are a challenge across South Asia, in fact. So Dr. Hassan, I'll turn it over to you. Dr. Hassan, you're muted.
Okay. So thank you very much for this very lovely report. It is very reader friendly, I must tell you. And the core message about your lifespan getting shrunk is something that people would feel very closely related to. So I found it very useful, and the messages around that you have in the book is very strong. So I hope our policymakers really read the report and take actions accordingly. So thank you to University of Chicago and the EPIC Center. And thank you very much for giving me the doctorate degree. I don't have it as yet. So I've got it free from you this evening. So do you hear me? Do you hear me, or I'm stuck?
Yes, yes.
Oh, yes, yes, yes.
Okay. So see, I think the recent episode of COVID-19 has exposed to all Bangladeshis the miserable condition of public health management here in Bangladesh. And the stand of the government of Bangladesh about development is we have to first develop like China, European countries, and US and Japan, and then take care of our environment. And when Purnima was comparing air pollution with tobacco, I would say that air pollution is even worse, because on tobacco, you have a choice, Purnima. You can say, I would take tobacco, I won't take tobacco, but no single person can say that I would stop breathing. They will have to inhale the air, and if the air is polluted, they'll just have to face the consequences. So going back to the stand of the government of Bangladesh on development, it first wants to develop and then take care of the environment, completely missing the point that because of its reckless development, because of its uncontrolled development, we are actually not making our development sustainable. We are even losing part of our, significant part of our GDP, because we have to handle the pollution problem, healthcare problem, and the environmental problem that polluted air is causing. So I would say that every citizen of Bangladesh must ask for a better management of our natural resources. We must demand that our air quality is maintained properly, because this is something without which you can't even survive for 1 minute. This is something you have to be constantly taking. And it's something that nobody should take as his or her own property. And nobody should think that his or her government has the right to pollute it. Because if development comes without any regulation, then the curse of it, what the curse of it can offer, we have already seen in other parts of the world. When people talk about China taking measures to control their air pollution, of course, they deserve all the congratulatory notes on that. But one thing I must point out here is the fact that the coal projects that the government of Bangladesh has planned to take, we had just 5 years back 1 coal-based power plant. Now we have moved to 29 coal-based power plant. And out of this 29, 16 will be funded here in Bangladesh with money coming from China. So pollution getting shifted from one part of the world to the other part is something we really need to talk about. And we have our national development dynamism. We are following the exploitative mode of development like the Western world, without taking into consideration what that exploitative mode of development has actually caused to the world. So we are not improving our public transportation system. Rather, we are, counting how many public cars have been purchased by the citizens of Bangladesh. Nobody is counting what amount of emission those cars are causing. So I would say that in Bangladesh, we really and immediately need to have appropriate public policies in place, policies that would talk about institutional mechanism that would take care of the air pollution problem, policy that would set standards for different sections. There has to be a monitoring system, and there has to be utmost transparency in the monitoring system. They do have air quality monitoring stations here, but it is often alleged that the stations that we have are not placed in the proper places. The places that are less polluted, the stations are set up there. But people really need to know what air they're breathing. Just 2 days back, I was dealing with complaints from 29 ship breaking workers. All of them have been diagnosed with asbestosis. So it's not only the urban people in Bangladesh who are inhaling the general generally polluted air, but there are specific sectors where people are working and inhaling even worse quality of air. So there has to be absolute transparency in the entire process of monitoring. And I would say that there has to be openness in information sharing. The laborers who are working in industries that have more polluted air should be told that this is what you're going to inhale, and do you really agree to work in such polluted environment? That is not happening. On the other hand, dirty industries are being transferred from the developed part to our parts of the country. And in addition to having measures in place that would actually prevent emission, I think we really need to talk about soft measures such as afforestation, greening your city, which some of the soft measures where public can also participate. And in Bangladesh, although it very often takes the first position defeating India, in terms of air pollution, we don't have a warning system in Bangladesh. We see that having less polluted air in Thailand, they would go for immediate closure of schools and colleges. But we have never seen any announcement from the government of Bangladesh saying this is the state of your air pollution, so the children should not be going out, or you should be wearing masks. And it is becoming increasingly important because of the COVID-19 challenges, because it's being said that the COVID-19 will be posing more challenges to societies where the air will be more polluted. So I think there is need for immediate action, coordinated action. And because in Bangladesh, India, Pakistan, air keeps on traveling from one country to another, we should also be talking about transboundary air pollution. So I'll stop here, and then if there are questions, we'd be more than happy to answer. Thank you.
Thank you, Saida. Sarah, do we want to take questions now? How would you like to?
Yeah, sure. We can start with questions. So we've gotten a few questions on the report for Anat, but then I think Purnima and Rizwana can join in. There's one from Nitin Sridhar.
I had a couple of quick questions to ask the panelists. I was hoping I could. So I just had one question to each of you that came to my mind as I was listening. So Saida ji, one of the sources of pollution, for example, air pollution in a city like Dhaka, also in many parts of North India, is pollution from small brick kilns and other industries like that, small industries. And we've been struggling to Bangladesh has been struggling to clamp down on that, as is India. Is the problem, do you think, not having the right environmental laws in place, or is it an enforcement problem? And what's the legal reason? What's the reason why legally these things seem to continue without?
Okay, do I answer first?
Yes.
Okay. See, Bangladesh has an institution which is called House Building and Research Institution. And it was set up immediately after our independence, so back in 1972. So almost 50 years have passed, and this particular institution has actually provided the government with alternative bricks. And in your report, you have mentioned about it. But the thing is, it has to be a political decision, and there has to be law in place which would ban setting up of new brick kilns that would burn the bricks. We have a law in place, but that hasn't banned. It has given the government the power to ban burning of bricks. But when the government would exercise its power, that would depend on the political commitment of the government. So I would say that it's rather lack of political commitment, rather lack of a vision for the environment of the country, rather lack of a vision for the city in which we live in. It's because law you can change any moment. I also saw a question about China can do and undo whatever it wants to wants with its population. I think Bangladesh is also the same. And when it comes to imposing arbitrary development decision on us, Bangladesh can exactly behave the way China behaves. I mean, there we don't find elements of democracy at all. So to answer your question shortly, I would say that it is rather lack of technology or recognition of appropriate technology by the government, which would then lead to changes in the policy and legal regime. And it's of course the economic interests of 7,000, at least 7,000 brick kilns owners, and their economic interest has connection with the economic interest in some of our politicians. So things slow down. So if you prioritize the right to life, right to health of your citizens, then you actually take the right decision at the right moment, particularly when you have the technological packages on your table. It's just about you considering it and making it mandatory and taking bold decision. For that, you need the political commitment.
Thank you. That makes a lot of sense. I think some of that mirrors what you see in Pakistan and India. Some of it in India is just a lack of enforcement. The law is there, but it's not being enforced. Purnima ji, I mean, then speaking to sort of the Indian context, one thing I was wondering, since you're working specifically on the health spaces, over the last few years, there have been a few instances where, top scientists from the Central Pollution Control Board, for example, have said that, there's no evidence that air pollution has impacts on health, or that Indians have built up an immunity to air pollution because, we live in a polluted part of the world. This is something that a former minister also said at one point. Has that gap, do you think, started decreasing? I've always thought it a bit odd because, on the other hand, the health ministry in India has actually brought out reports talking about health and air pollution. But the environment ministry's job, it is actually to control this, has tended to stay away. How do you think sort of policymakers are looking at this right now in India?
Yeah, thanks, Anant. I mean, that's a loaded question. So, well, the short answer is that, there are health impacts. There's no two ways about it. The debate around whether it's true for India and closing the gaps can only happen when we have access to data to grow that evidence base. I will not say that there is no evidence in India. There are pockets of research that have happened earlier and are continuing, and they will only grow. But there's always the stonewalling that happens when you have to access the exposure data. So unless you have the data on the air quality, the air pollution levels across regions, you cannot relate it to the health outcomes. And it's a very big barrier for health researchers. Unless you have access to the air quality data, you're not going to be able to grow that evidence base. And the problem here is not just what we have always heard, that we don't have enough air quality monitors in India. It's very inequitably distributed. There's large parts of India that do not have monitors. And what we don't know, we don't see. If we don't measure it, we don't know what the air quality is in large parts of the country, tier 2, tier 3 cities, for instance. The conversation is always Delhi-centric. There's always attention on the mega cities, the metros. But what's happening in some of the smaller cities is something we don't know, simply because we don't have the data. And let me tell you, I mean, there is a lot of research happening in the health space, relating not just to respiratory health, but also in terms of cardiovascular disease and the intermediate risk factors that get there. Some of the preliminary work that we have done also has shown, like, even a 25 milligrams increase in PM 2.5 can cause something like 3 millimeters increase in blood pressure in the population at the population level. And that may sound like a small figure, but if you start looking at how that translates into impacts and growing burden on the health systems. We already have an overburdened health system. The COVID pandemic has just kind of, shown that more, how poorly positioned we are in terms of public health infrastructure. So in an already overburdened health system, even those small impacts on health, how many more people are going to require treatment for increase in blood pressure, or increase in respiratory effects. There is a lot to worry for from the health angle. So I think all these policies that we're talking about, the environmental laws, it's so important to bring the health lens on all of it, and bring health at the center of all these policies. Even all the, the economic stimulus packages that we've been talking about for the post-COVID era, an important component has to be the health lens. And I think many of you will be aware of the collective advocacy by the health professionals to the G20 leaders recently through that open letter. And the prescription, the WHO prescription also speaks just to that. Like, we have to build the health conversation in a bigger way. The drumbeat around health has to be enhanced. I'm not sure if I completely answered your question, but yes, there is evidence and it's just growing. But we need more access to exposure data to move that ahead.
Yeah, and I think actually there, one thing that might be of interest is in fact the new AQLI website, because the new satellite data, which can be freely downloaded, it's down, as I said, to the district level across India and actually in Bangladesh as well. It's the correlation now between ground monitoring and the satellite data is up to 91%. So, there has been this tendency, especially on the part of policymakers, to sort of, what you don't see won't hurt you, if you like. And as you said, we don't have monitors all over the place in any of these countries. I think these data sets now, they've been traditionally hard to work with, requiring sort of expertise on how satellites work. But I think this, I mean, you may be interested, and others who like playing with data might be interested. It can all be downloaded, and it's, as I said, now the correlation with ground monitoring is very, very high. So, one can really look at it as a measure of what's actually going on. We have a number of questions on the chat. Sarah, would you like me to sort of pick them up, or
I'm happy to read some out. A couple are for you as well about the report, so I can ask them. So we have one from Nitin Sridhar from Mint. We know how air pollution levels worsen in North India during the winters. How important will it be to address air pollution issues this year, especially with COVID-19 in the frame now? And this might be a question for Purnima as well. Anant, if you have thoughts first.
I mean, everything we know about COVID-19 is in a state of flux and uncertain. But given those caveats, there's certainly evidence that, if for example, you're asthmatic, if you have trouble breathing for any external reason, any external stimulus, and air pollution is one of those, then when you combine that with a COVID infection, you're likely to be much worse off. And so I think, with the caveat that there is uncertainty around all things COVID, it does look like there is, to the best of my knowledge at least, and Dr. Prabhakaran is more of an expert on that there is a strong negative interaction between the two, and it's more dangerous, going to be more dangerous in highly polluted parts of the world than not. I'll let Dr. Prabhakaran add anything if she.
Yeah, I mean, just to add the perspective that we already know that people who've been exposed to chronic levels of poor air quality are already vulnerable. So they already have a compromised lung function, and that's why links to increased vulnerability to infections like COVID, as well as any other infections. So in response to particularly to this question, should we be addressing air pollution levels? I don't think we have a choice. I mean, it happens every year. Air quality deteriorates. Maybe because the lockdown and the extended kind of work from home situation that most people have, the vulnerabilities are naturally less. It's become like a natural experiment. You stay home, probably the respiratory infections showing up in the hospitals will be less this year, and so also the other morbidities. But I don't think we have a choice. We have to address air quality issues, and I hope some of the measures that stopgap in measures that people do, like whether it's the odd even or shutting down power plants. I think all of that cannot take a backseat. I mean, here air pollution is here and now. COVID is around for sure, but this definitely requires attention.
Thank you. Now, another question on the report for Anant. Can you explain how an averaging of life expectancy between less polluted and highly polluted areas affects citizens by 2 years across the world? Won't people living in clean air areas fare better?
Yeah, so I mean, in fact, if by land area, there is a much larger surface of land where the air is relatively clean than there is where it's highly polluted. So most of the United States, for example, Western Europe, Northern Europe, yeah, those are all areas where you are at or below the WHO standards, and although there's no level of air pollution that has zero damages, everything on the AQLI is benchmarked to the WHO standards. But there are a lot of people who live in China and South Asia. And so, what we've seen there over the last 2 decades is that China's gone down, especially in the last 7 or 8 years, and the rest of South Asia has gone up. The two approximately cancel each other out, and we see a pretty constant 2-year decline in life expectancy on average across the globe. So that's sort of how it's worked out. And you can zoom in on any part of the world and see what the change has been there.
Thank you. This is a question for Purnima, but I think that then Rizwana could also give the point of view from Bangladesh on policy. The question is, the public health perspective to development is totally ignored. Until the Department of Environment was established, in India at least, public health was an important consideration. Now environment has overshadowed health and taken away the discourse. Unfortunately, both environment and health professionals are responsible for this. Do you see any way forward to change this?
Well, at least at the level of, researchers and public health professionals and environmental exposure scientists, I think we've started talking to each other to bring the two disciplines together and, grow an evidence base for India that we can effectively use in our conversations with the policymakers. But I think it also takes political will. And unless the two ministries talk to each other, I think the Ministry of Health and the Ministry of Environment have to come together in all of these discourses, and not to forget, it requires a lot of intersectoral coordination. Ministry of, the surface transport, the power, energy, all of these different stakeholders have to come together. And unless there's that kind of political will, we are not going to be able to address this issue very quickly. And definitely the health conversation in all of this, every policy that happens, whether it's the Ministry of Environment or the Ministry of Energy, the whole conversation about transitioning away from, fossil fuel combustion to clean energy, renewable energies. I think if you take a health lens on that, things can be done very differently. And I think we try that all the time to bring all the different stakeholders together, but a long way ahead to get to some tangible outcomes.
Thank you. And Rizwana, how do you see the situation in Bangladesh coming also from the legal perspective? Is there just a disconnect between different groups and agencies?
There is this disconnect in every aspect of our administration, not only environment and health. If I read my environment policy, I see a separate section in it on health, how environment and health are interlinked. If I read my health policy, there is a chapter on how environment is affecting public health. So policy mentioning is there, but these two ministries, the health and also the agencies like the Department of Environment, the Directorate of Health, they hardly come together. If they come together, and if they assess the situation together, I think the communication of both the ministries would improve. You know, they'll have stronger messages to convey for the industry to rectify, for development to be regulated, for the transport sector to be regulated. If it is only taken as a fight for the Ministry of Environment and health gets totally missing there, it's not going to bring the desired solution. Often, when you talk about environmental pollution, the development priorities really outweigh the environmental considerations. But if environment and health could be linked together, and we could show that how this development model is affecting our lifespan, how it is giving us diseases, the fact that we don't really live in a welfare state, it is our pocket that is charged whenever we are getting sick, that we are having an unhealthy future generation. If all these factors could be, you know, arranged together, then the communication coming out of both the ministries would be much more stronger, would have more appeal to the general people, and I think would be more effective in handling the reckless operation of the other ministries, like the Ministry of Energy, Transportation, Ministry of Industry.
Thank you. A question for now from Lou Del Bello. China seems to be doing very well, but as is often the case, measures are effective because China is a regime and can impose whatever drastic measures they think may work. Are there any lessons that democratic countries could still learn from China?
Yeah, so I think, well, I think to Saidaji's point in the beginning, the idea that that the specific steps China has taken to reduce air pollution are things that democratic countries can't do is probably not the case. At a minimum, I think one lesson we can take away from China is that it is possible to grow quickly and reduce air pollution at the same time, because they've done that. Now, the policy mechanisms and tools we might use to reach that point may differ. But I think if you look into the details of the types of things China has done to reduce air pollution, for example, shifting out of industry, they've modernized their regulations. So they're using much more use of market-based regulation, for instance. These are steps that are either already enshrined in law in India and in fact in Bangladesh and Pakistan in some cases, or are well within the scope of things that you might imagine these governments could do. So yes, the politics of taking action is easier in China in some ways because it's not a democratic country. But the specific steps they've taken are not something that you couldn't see other countries in South Asia taking. So I think there's very much a lot of things we can take away from that.
And maybe Purnima and Rizwana, you might have thoughts, in your advocacy work, do you point or look at any examples in China that you think are good, or vice versa, any lessons that should be learned and not repeated?
Should I go first?
Yeah, go ahead.
Usually the laws in China are super complex, but if you read the air pollution control law of China, it's not very complex. And one thing I really liked about the law is the decentralization of institutional arrangements. So China has empowered the local government agencies and have required them to give or to have real concrete action plan as to how they are going to reduce the air pollution in their given territorial jurisdiction. So this decentralization aspect is something that I really liked, in addition to what has already been said. And the other thing is about the greening of the cities. Like every local government organization will have to undertake this amount of tree plantation to ensure that this ratio of land is covered with tree. This is something I liked. And the other thing I liked is the provision of reward, that it is not only about punishing, it's also about giving rewards to people, to individuals, to agencies who can show positive changes in the air quality because of some innovative measures. So this is something I really liked.
Yeah, just to echo Saida there, like, I think decentralization is extremely important. And we've often heard the quote about India being a country within countries. Every state is different. And health is a state subject, interestingly. So, I think there's enough scope there for a decentralized action plan at every state level. We do have it. We are heading in that direction. There's lots of states action plans. There are city air action plans. And I think if we take it down to that level of action, success stories may become evident sooner than later. But there's got to be, again, a very intersectoral way of doing this. It cannot be just the health department or the environment department. It takes a lot of different sectors to come together for ground level implementation of the policies. I think that's important.
Thank you. Now another question about the report for Anant. The AQLI lost/added life expectancy numbers are based on WHO prescribed limits, but in several regions, such as the Indo-Gangetic Plains, background PM levels are higher than the prescribed levels, even without anthropogenic sources. How does this affect indices like the AQLI, which are based on flat theoretical prescribed limits? And how can this natural variability be reflected in the AQLI?
Yeah, so that's a very good question on interpretation. So the AQLI is it's benchmarked to the WHO sort of norms, but it doesn't have to be interpreted only with respect to the WHO norms. So what I mean by that is the AQLI tells you that if air pollution changes by so many units, life expectancy goes down or goes up by so many years. If you look on the AQLI website, for example, you can ask the question, okay, in the last 20 years, how much has the change in air pollution in, say, India or Bangladesh affected life expectancy? There's a button on the website that will show you the life expectancy loss relative to each country's own national standards. So for example, in India, the national ambient air quality standards are higher than the WHO standard. So if you ask what is the life expectancy loss relative to that higher bar, that number is going to be a little lower than the 5.2 on average. But from a policy point of view, there are two things I think to take away. Regardless of which benchmark you use, these numbers are frighteningly high in South Asia. So in that sense, the message doesn't change. And the second is that what we're really doing as when we're making policy and when we're reading about policy and as citizens is looking at how air quality changes. And so those changes in air quality are then free of any index. It doesn't matter that's independent of the WHO or anything else. And you can think about those changes in terms of changes in life expectancy. And that has value not just as a communication device, I think, but it also has value in bringing together what we've been talking about, the world of sort of health and the world of sort of environmental standard setting. And the idea of converting environmental standard setting into terms which are explicitly the language of health improvements, and in particular a metric that is used across diseases, I think may help drive this policy in a more rational way. You can say, if I spend so much money on reducing air pollution, well, this is what I hope to gain in life expectancy increases. This is what it would compare to if, for example, I was spending money on reducing malaria. It's not either or, but it helps you benchmark the value of one in terms that we're comfortable listening to. That's how I think about it.
Thank you. So we have 5 minutes left, and Dr. Purnima especially has to leave right on the hour. So I'm going to ask what I think will be the last question, which could really be for anyone to answer. So you can put up your hand. I will put my email address in the chat, and I'm sorry we haven't come around to all the questions, but if you email me, I will make sure that they get to the right person who can answer the question. And the recording will also be available, so I will send that. The question is, I understand that having one clear metric, life expectancy, helps simplify communications, but I wonder whether you also have ways of capturing and communicating differences in the quality of life, as well as the quantity of life. For example, the number of asthma attacks or hospitalizations. And that, Purnima, is something that you were talking about with sort of the added health problems of high blood pressure or other issues. Maybe you want to come in first.
I think it's a question to Anand, but I'll just bring in another perspective also. Like, I think it's kind of related to what Chloe's asking here. I agree, like, you know, it's very compelling to say to the policymakers that if you don't bring your air quality management levels to the appropriate, you know, levels of action required for your region, this is the number of years that will be lost, you know, for your population. But there's also a different perspective, and I think I feel that more as a public health professional. What about the number of years lived with the morbidities as a result of exposure to chronic levels of deteriorating air quality? I think there is another metric that could be used, and I'll encourage EPIC maybe to look at it next time. I know you've been working a long time on the life expectancy. There is the DALYs, you know, the disability adjusted life years, which is actually a sum of years of life lost due to premature mortality, plus the years of life lived with morbidity. You know, it's a metric that combines the two things: how many years you will have lost, but also the number of years you live with poor quality of life. And I think that's what Chloe is alluding. That would be a very interesting metric, maybe, you know, to make some very compelling arguments, to make some very strong policies for dealing with air pollution in India and elsewhere, actually. So I think that would be an interesting metric to look at if possible. So I think rightfully to be turned over to you in terms of.
I thought I'd ask Saida ji what, you know, in her experience, sort of what sort of messaging works best to communicate to people that this is their problem. This is actually something on which we've been doing a lot of research actually before COVID on how do we get people to wear masks in India. You know, nobody wears masks. And so the question, you know, we've been trying to figure out sort of what's the right way to personalize or communicate these things in ways that engenders action. And I was wondering whether you have any thoughts on that. And of course, this is a central part of the question, sort of, you know, should we talk about morbidities? Should we talk about life expectancies?
Yes. I think the best way to tell people about how a problem affects them is the best way to draw their attention to. If you talk about petroleum standard, 98% people won't read your report. But if you say how not having petroleum standard is affecting the health of people and is actually leading to less years in terms of how long they would live, that would they would be able to relate to that instantly. So I think you have done a brilliant job by saying that life expectancy will be going down, and no government has the right to undermine the right to life of its citizens, both qualitative aspect of it and the quantitative aspect of it. So I think this was a very powerful way of communicating the message to the people. And when people get connected to the message, it creates some sort of a pressure on the policymakers. They can't be reluctant to this type of, you know, findings. I mean, your democracy may be functional, your democracy may not be functional, but so long you call your government a democratic government, you simply can't, you know, turn a blind eye when people are saying that, look, you're not doing this and that's why our life expectancy is getting affected. Our generations are being badly impacted. So I think this was the right way to go by. There are different ways you can think of, but I think the way it has been said in the report is very powerful. At least it moved me. So I'm sure it will be moving the general people as well.
Okay, so thank you very much with all of that. Thank you to the AQLI and Anant. Thank you to Purnima and to Rizwana. And yeah, we look forward to seeing your coverage too. Thanks.
Thank you very much.